Hello, my name is Austin Rogers, and I'm a fourth-year general surgery resident at East Carolina University in Greenville, North Carolina. I have nothing to disclose. I will be presenting the establishment of a per-oral endoscopic myotomy program at a rural tertiary care center on behalf of the Thoracic Surgery Department in Greenville, North Carolina. The purpose of this study was to determine the application and effectiveness of a per-oral endoscopic myotomy program in the rural healthcare setting. Achalasia has an incidence of 1.6 per 100,000 new diagnoses made per year. Traditionally, a halar myotomy with fundoplication has been the surgical standard of care for treating achalasia. In 2008 in Japan, the first poem was performed. Since 2017, our institution, which is located in a rural tertiary care center, has performed approximately 60 poems. An IRB-approved single institution retrospective review of patient outcomes after poem was performed, along with a prospective analysis of postoperative surveys. An institutional cost analysis was performed to show the fiscal benefit of establishing a poem program at our institution in 2017. Demographic and qualitative variables, along with clinical outcomes, were measured. On the left side of the screen, you can see the creation of the submucosal tunnel during poem procedure. On the right, you can see the full thickness myotomy. So our demographics, we studied 41 patients that had received poem. They had an average age of 58 years, average weight of 76 kilos, and an average BMI of 27. Our patients were predominantly female at 58% and predominantly white at 61%. In regards to outcomes, our average length of stay was 2.5 days. Average dysphagia severity score was 6.4. Average total Likert scale of symptom improvement score 12.6, with 72% of patients being satisfied with their current condition, 58% using PPIs pre-op, which increased to 65% post-op, 7% suffered minor complications, and 78% of patients reported complete resolution of their symptoms. The number of myotomy operations performed increased from 7.5 per year to 36 per year after the initiation of the POEM program. The laparoscopic myotomy intraoperative supply costs were a little over around $2,500. The POEM intraoperative supply costs were around $1,600. The capital expense of the equipment required to perform POEM was a little over $110,000, with the average contribution margin per case a little over $6,000. The procedure paid off capital outlay upon completion of the 19th case. The results of this study show that patients have excellent symptom control after POEM. When compared to the institution's laparoscopic myotomy volume, the POEM procedure far surpasses in terms of operative volume and monetary benefit. Examination of this data shows that a rural hospital can successfully employ a state-of-the-art intervention when there is a population in need and an infrastructure in place.